So if you look at the orbit, this is the head, and that's the foot. So my ring stand goes always at the head of the patient, and my meal stand always go at the feet. My table in the middle. Prior to starting, I go to the sterile core or sterile room, and I get my pack, my basin pack, and my gown and glove. And I position them in the place, in the order that they should be, okay? The first thing you want to do is open up your pack to make my sterile barrier. My basin pack is second, my gown and glove is third, okay? Basic pack or linen pack. Basic or linen pack. My basin for the ring stand, and my gown and glove for the male. And then you proceed to open up, and this is before you scrub, okay? Because this is not sterile, and the outer isn't sterile, only the contents. So once I scrub gown and glove, I'm sterile, so I can't do this then. Make sense?
Yeah.
Okay. So you always open away first, and then the last one is to you. And then you see this is the rough edge that's showing, so that's showing me that it comes to this side. I can move my meal stand out of the way. I come all the way to the side, I grab, and I can lean on the table because there's no barrier here. I pinch, I pull down. I walk around to the other side, and I make sure I have that distance of a foot to 18 inches away. I can push this out of the way because it's not open. And pull down. Always make sure that you're standing in front, that the opening for the package is to the front. So I'm concerned about this side of my table where I'll be, not that side. Okay, so you press, tells you to press.
Okay, one question real quick. I see you're open. Where's your patient at? Or where's your table? This is where your table's at?
Yes.
Okay.
Go away. Now, because it goes to the side, and you're looking, because I can't walk here, because then my back is to a sterile field. So I have to turn so that the opening is to me. So then I pull on the side, and I pull down, and this is double wrap. Then I reach around to the metal part of the stand, or I can go to the leg part, which is below tabletop, right? And turn it. Now this one is double wrapped, why I don't know. So I do it again.
Aren't they usually double wrapped?
No.
Ah, I used to double wrap.
Okay, so now I'm turning. I'm looking for the rough edge. I see it's here. And I need to make sure, see this end that's below, that it doesn't touch my table there. So when I'm pulling gently down so that it doesn't pop on top of my table. And I can just push that just a little closer. Because I don't want nobody to come and try to walk through there. Okay, and then I bring my meal stand closer, still that distance apart, open away, right and left, or left, right, it doesn't matter, and to the side, to me. And I flip my gloves. I'm gonna just wet my hands.
Good idea.
And this should take you, what I'm about to do, no more than 5 to 7 minutes to complete.
Okay, if your circulator's not there,
I would drop it somewhere.
Yeah.
if
Whether it's in
Mine
the
will.
trash can,
Well,
on the
Yeah,
OR
that's
bed,
the
because
pause.
remember, my patient is not in the room.
That'll
So I can
stop
drop her on
it.
the OR bed until the circulator comes to get it?
Yes, okay.
Mhm.
Stupid iPhones.
Android all the way.
Well, I know I'm going to get me one. I had them before.
I love them. Samsung.
Yeah.
Look how quick she does it.
Well, yeah, they're professional.
Don't put them in no circulator. Let me be frightened.
None of that, nah. Y'all on video.
Oh, I should have done that.
I can probably email this to whoever.
You have to send that to me.
Yeah.
That's smart.
I felt bad for Fields, so I'm like, well, if I videotape it, I can send it to him.
You see, I stepped away so that my circulator could remove my paper. I do not remove the paper. Okay, you can do my time. Is this an anything?
Yes,
I'm the only one who ever high school.
there you go.
Huh? Alright, I'm going to stop it. Give me a minute.
Okay, so the next thing, in your chapter, talk about extending your sterile field. So that's where the mail covers come in. It tells you left hand, right hand. And I have some extras on the bed for you to work with. You put your hands under the cuff, and you're gonna do, you remember that little, I don't know if y'all remember that little football game, but your fingers is gonna hold the contents of the mail cover so it doesn't drop. The other two fingers are like this, they're open to go over the stand. So I'm tucked underneath. Y'all can see my opening.
Yeah.
So now I can't bend and try to look because I don't know if my mask's gonna touch. Okay, so I'm just going with what I know. I proceed to slide it on. I step on the thing so it don't roll all over the place. So then I go as far as I can. It stops. I step to the outside and I can put it on, or I can stand in front. I step to the outside because this comes up high and I'm short, so it may touch my mask and I don't know. But if I'm to the outside, it's over here, and all I'm doing is sliding it on. I get a blue towel. I lift at the back, tuck. I lift at the front and tuck. And then I do my two sides. It's almost like making a bed. Mr. Goody is anal about this. Ms. Palmer isn't, but I do want to make sure all my corners are tucked. Okay? You know what's not in here? All my linen goes at the head, close to the basin. Okay? I don't have a table cover in here. So these are all my sheets. There's one on the bed there. Look, you can take this wrapper. I'm gonna give you one of them. Wait, let me give it to you. Okay. The reason I'm hesitant about it because I'm bringing what's below up. But I need her to wrap that. Now, because I'm waiting for my back table cover, you stack all your drapes and surgeon's gowns. In your basin.
That's huge, so.
Watch my mail. Okay, this this is a back table cover. This reinforces this joint. Okay, now I could either put this back here, but this is sterile, so I can set it here. The thing is not to let, now Mr. Goodis said you let it go to the, you see how if I open it this way, the double reinforced is front to back? I want it to be lengthways. So now what I'm gonna have to do is position this to fall this way. You see I'm holding it with my right, smoothing out with my left. And my hand staying at the tabletop. So now I've reinforced it double. My circulator can walk around my table, to pull on it, but you make sure you're holding it with your hand and secure it so it doesn't shift. And notice when you move your ring stand, it's only table level. Okay, so now I can close this, and I can close this. This is a trash bag. You may see some people hang it on, do this. Ms. Palmer doesn't do this. And then they put trash in it. But it's suppose I drop a blade in here. That means I'm going below tabletop, right? To get this. So that's why when I get my trash, I put up my bag on the table and I put all my trash in it. And then I discard. This is my suction. It goes on my first mail. My light condoms for my light. These are my basins. They go closest to the mail. I have several of them. I don't have to scatter them all out. My 2 Aseptos are bulb syringes. This is my Bovie with a tip. This is what I'm counting, Bovie tip only. Okay? This is an extender, Bovie extender. The tips look the same except that makes this longer, a deep cavity. They have marking pens, Yanker suction tips. All I need is one. My Bovie scratch pad. I need to take that out of the package, put it on my mail, because all of this is going to sit on the patient. This is my needle book, where I put my dirty needles in, and my blades go on this side because it's magnetic. This goes here. In this package, this is an Emerson basin, and some of them, they're going to have a rectangle. They still go right above your needle book, okay? I put this extender in there. My marking pencils are in there. And I also have a ruler in case they want to measure the size of the specimen. That's in there, okay? Now this set was for a neuro case. That's why you see all this extra. I don't need it. Here's my blades. I have 1, 2, 3, 4 blades. Okay, this is my medicine cup. If they got to give me local of some sort, or some type of injectable. So, I'm finished with all of this. I know I won't need this, so I'm putting this back. This is labeled, so if they do give me some Zolocaine, I need to write it on there with the marker and label it. So in case I leave and go to lunch and the case is still going, the person relieving me will know what it is. I also label my saline irrigation. I don't need this, I don't need a stocking net, and I don't need this vibrate. So, neither this, what you call that thing?
Is that Coban?
Coban.
Coban,
So I
yeah.
can give all of this to my circulator. Please pay attention how I give it to my circulator. I am on this side. No, I need you to stand over there. Push back some more. Because she has to be 12 to 18 inches away.
Yeah.
So I can extend it out. So you see, there's no way we can get contaminated. I won't do like this. Oh, here, take this. It's
then you-
always,
Like that, hand it off and
Yes.
get it, yeah.
okay?
All right, so that's your basic on your table. Can I take a picture of it real quick?
That's my what?
Your basic stuff that's on your table.
I'm not finished.
Okay.
I'll send you a
Next thing you
recording.
have to do is to make roll towels. This is the roll towels for that basic set of instruments. Ms. Christopher taught y'all with the long instruments with them. And all I do is take the towel, fold in. Mr. Goody gonna tuck the corners. I don't do all that. I just fold it. I want it thick and firm. And I set it right in the middle of my table. I also have to do one for my mail stand. This one, back table folds this way, mail stand folds this way. Okay? And we're gonna practice it, so. Because you don't want your roll towel to hang over the edges. You see, that fits in. See how this one is too long? It's always at the open end, because your instruments are here, going this way. It's curved stats, straight stats, Alice, Babcock, all of that. So, oh, Miss One, I don't have no laps. Go look in, look in there. You're gonna see two baskets. Pull the first basket out, look at the bottom of the second. So I always peel my blades out to count, because I don't assume that's what's in it. So I need to make sure.
Do you
And I
have
just-
something small I can wrap it in?
No.
Can I use your gown?
Yeah, my gown wrapper. Don't throw my wrapper away. I don't think that's gonna,
Shoot. My battery's low.
And the needles won't come off of there because it's magnetic.
I don't have needles.
I mean,
No, blades, no.
No,
No, see?
Okay, all right.
Damn it. I'm gonna run
So
out
this
of
is my
battery.
sponges. So I'll tell my circulator I'm ready to count. If I'm going too slow, she'll ask me, because she's paying more attention to the time than I am. Are you ready to count? And I'll say yes. So it doesn't matter where you start. It's up to you. You just need to make sure that you count everything. She will have a piece of paper with the items listed, so she could call them out to you and you count, or you can just start counting and go from there. Do not take the wrappers off items until you're ready to count. Okay, Raytex sponges. You always pull at the fold. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Laps. 1, 2, 3, 4, and 5. Blades. 1, 2, 3, and 4. Bovie scratch pad, my Bovie tip. One Bovie extender, so I have 2 tips. 4 blades, 5 laps, 10 sponges. Now I need one of you to be a surgeon. Who have their mask on? You have your, give me a pair. Look in there, they have some gloves in that, they're blue basin. I need you to get a pair of 8s out. I need you to wet your hands.
A pair of 8?
Yeah, 8 is fine. You see a wrapper, look up there on the top, on the side of the boxes, on the second shelf where you are, eye level, not that.
I love
Come on the other side of the boxes. See that wrapper? Yeah, take those out.
It's gonna be like 3 different videos.
So because I have a gown, she don't have to give me a gown.
I'm about to die
But
there. That's the only
you
thing.
need
I have
to
a
give me some
backup battery in the other room, but I only got 10%.
So that's not how you peel them
You
open.
don't get the rest, I'm gonna record it on mine, but I can't pause.
Pay attention to how she's peeling open the gloves. Hold them, I'll reach in and I get them out. Come on, surgeon, you don't wait for the scrub person. I'll open the towel, give me one hand and one hand only because you push a little bit over. Extend it open like a pancake. I take the towel at the sides, not like this, long ways. I'm a distance away. I made sure she feel it. You saw her arm go down? Now she dries. While she's drying, I'm getting the gown so that she can put it on. I know that the face doesn't face me because I'm not putting it on, the smile. So I'm unfolding, but see, I'm a distance away from her. Circulator, you need to get in position. Because what the circulator has to do,
Tie the bag.
present it to the circulator. She immediately walks in. Here, I remember we talked about the sleeve. Open up your hands.
Whoa,
Man, I feel like.
wait, you can pull the hand out?
I'm doing open gloving to
Okay.
the surgeon.
Okay.
I did closed. Right glove, right hand. You take. Now you could fix